For those of you who are new to my channel, my name is Yasmin and I am a nurse. I am also a mother. And for those of you who are returning, welcome back, and let's just get right into this video. Today, I'm gonna talk about pediatric nursing, kind of what to expect, what goes into pediatric nursing, why I love pediatric nursing. I have been a pediatric nurse for now 3.5 years. I started right out of graduating from college. So I just went right into a specialty with pediatric nursing. I started in a PICU, which is pediatric intensive care unit, and then I migrated to the pediatric emergency room as an ER and trauma nurse. So that is where I am currently. I love pediatrics. I can only do pediatrics. I feel like you kind of figure out what you like and what you don't like as a nurse and in nursing school. And I knew from nursing school and doing clinicals and having classes that I was going to be a pediatric nurse, and that is what I have been for now 3.5 years. So it's crazy, but let's just kind of get into it and start. There's a whole bunch of differences between pediatrics and adult nursing. Even pediatric and NICU is so much different. Pediatric and mother baby, so different specialty. We're gonna get into the main ones that I feel are definitely the ones that stand out and what is so different about it. So we're just gonna get right into it and kind of dive in. So the biggest difference I would say is the age, obviously, right? Like pediatrics, you're gonna have from 0 days old to when you are a newborn coming fresh out of the womb all the way up until you are 18 years old is going to be all considered pediatrics. Anything above 18 is considered adults. Now, working in an ER, do we see kids above 18? Yes, we do. For the most part, they're complex kiddos who are followed by the doctors at a pediatric hospital. So when they come through the ER, they continue to come to the pediatric hospital because all their doctors are there. So we see that a lot. Sometimes we just see adults that come in through our doors as an ER into the ER, and we can't turn them around because we are a level 1 trauma center, and we can't turn them around. So we will stabilize them, we will get them seen by a doctor, and then we will transfer them out to an adult facility. So we do see above 18, but for the most part, when you are a pediatric nurse, especially when you're inpatient, as in you work on the floor, you work in the ICU, you're gonna see 0 to 18. In the ER is a little bit different, but inpatient, you're definitely gonna see 0 to 18 years old. So if that's what you like, pediatrics is where you want to be. And within age, your developmental stages are gonna be completely different. Babies can't talk, an 18-year-old can talk. It's just the basic, simple example that I can give, but it is gonna affect how you are as a nurse. How you do interventions, how you explain things, how you interact with the child's going to change depending on their age. So we have to be very mindful with ages in pediatrics because it's going to be completely different as they get older and start learning more and being able to verbalize more and things like that. In the adult world, you're pretty much treating every adult the same. I can go to an 18-year-old and I can go to a 60-year-old and I can pretty much explain something by just talking to them. I don't have to utilize other resources and things like that. For the most part, there are exceptions, but for the most part, I won't have to do the things that I do in pediatrics that I do with adults. When it goes for just talking and explaining things, just interventions or even doing interventions with pediatrics, one, it's going to take a lot more time. It's going to take time to be able to do things because kids don't understand. You can't just go in and say, I'm going to give you an IV. I'm going to give you a needle. I'm going to squeeze your arm really tight to get a blood pressure. I'm going to put something up your butt to let you poop. Like, you can't just sometimes go in and say that because they're not going to understand. They're going to be scared. So most of the time, the kids are screaming, they're crying, they're kicking, and just because they are scared, they're in an environment that they're not familiar with, and it's a change. And sometimes, a lot of times, kids don't like change. It's very scary. So there's different little things that, you know, as pediatric nursing, you kind of learn on as you get more experience, people teach you when you're in pediatrics, or just things to say and kind of be crafty with your words. I will never go in and say, I'm gonna give you a needle. Needle is like the scariest word for a child. So that's never gonna be something that comes out of my mouth. We say a lot of times that we're gonna give you a helper straw. Helper straw seems a little bit more friendly. Kids know a straw. They know you drink out of a straw. They know straws are bendy and flexible and they don't hurt, and they drink their favorite drinks out of a straw and chocolate milk and juice and all that kind of thing. So it's more friendly than saying, I'm going to stick you with a needle to get an IV, right? So we say helper straw. We get fluids through the helper straw so that we can hydrate you and things like that. So that's just one. For blood pressure, I always like to say, I'm gonna give your arm a hug. Do you like hugs? And they're like, yeah, I like hugs, you know? And I'm like, can mommy give you a hug while I give your arm a hug? And they're like, yeah. So they're hugging mommy, they're getting their arm hugged, and then we get a blood pressure. That's in like the perfect scenario. Do we have the kids that scream and cry and kick the entire time? Yes, we do. And that takes a while to get stuff, but it just takes a little bit longer. So it's not like, as a pediatric nurse, I think patience is one of the biggest things that you can have. I'm not saying you don't need it in other areas of nursing, but in pediatrics, you definitely need patience because you can't just go in and out of a room and just get things done super fast. Most of the time you have to take your time, explain things, do play intervention, things like that to get things done. Diagnoses are gonna be completely different, and you are gonna have your similarities between the two, but you're not gonna see certain things in pediatrics that you see in adults. COPD, you're not gonna see that in a child, but you will see diabetes in a child or in a 6-year-old, and you're gonna see diabetes in a 60-year-old. So some things are gonna be the same, but there is certain things that's gonna differentiate both the pediatric and adult. So you just have to be aware, and as you get into pediatrics and take your classes in nursing school, and if you specialize in pediatrics or adults, you're gonna familiarize with the diagnoses that you see the most often. And then you're gonna be able to intervene and have a lot of knowledge around those diagnoses. Just for an example, like we see, especially even in pediatrics, just the smaller pediatric and the older pediatric are still gonna be so much different. A 10-year-old's airway is gonna be a lot bigger than, say, a 5-month-old. So a lot of times we see these 5-month-old babies come in and parents are super scared and they're nervous. It's still so fresh. The baby's 5 months. It might be their first child. It might be their 10th child, but I feel like it's still so fresh, and parents get nervous all the time. So we see a lot of the times, especially in the winter seasons, these 5-month-olds come in and parents are saying they're not drinking, or they're choking when they're drinking, or they just seem super congested, they're breathing funny, they're breathing fast. And a lot of the times we suction these kids and they're like night and day. Their airways are so small that, and they breathe and they feed at the same time. So sometimes if their airway is so clogged with snot and mucus, they're not gonna wanna feed. They're gonna say, I don't wanna feed, mom, and I'm just going to not feed. And then they stop making wet diapers, or parents start freaking out, and that's completely understandable, but sometimes they just need a really good suction. So we suction these kids, we get all their snot out, and then we challenge them to feed, and they do great, and we send them home, and we just encourage suctioning more frequently, suctioning before feed, suctioning before bedtime, things like that, just to keep their airway open, because a 5-month-old airway is so much smaller. It's still growing. A 10-year-old, you're not gonna see them come in not feeding because they have snot in their nose. You're not gonna see that. Their airway is a lot bigger. They're able to blow their nose. It's just different between a 10-year-old and a 5-month-old. And that is the entire span of pediatrics. It's gonna be so much different as kids get older and get into each developmental stage. Family-centered care is a huge thing in pediatrics. Obviously, because pediatrics are minors, they need their parents there at all times. And just to give an example, with COVID right now, in an adult hospital, and I'm only speaking for the adult hospitals near me because I don't know every policy around the world, but for the adult hospitals near me, if an adult gets admitted to the hospital, there is no one going upstairs. In certain circumstances, I think that if it's hospice care or Labor and delivery can have a support person, but for the most part, a general floor, you're getting admitted and you're not having any supportive people, any loved ones upstairs with you. Now, in a pediatric hospital, and in my pediatric hospital, when a kid gets admitted to the hospital and has to stay overnight, they're allowed 2 healthy caregivers. So that is a huge deal. Kids are minors. They need their parents there because the parents are the ones that make decisions. So as nurses, as healthcare providers, as the team that's taking care of this child, family-centered care is so essential because you need the parents to be on board with what you're doing, because ultimately they have the final say. If they don't want something done, they have the right to refuse. They have the right to decline. They have the right to leave against medical advice for their child. In regards to their child, they have that right. So we can advocate for the child. We can explain from our medical expertise what's best for the child, what the child needs, what tests they need, and lab work and whatever else, but the parents ultimately have that decision. So it's definitely something that in pediatric world we're very aware of, and we like to include family in all that decision making. Especially when I worked in the PICU, parents were included in rounds every morning. The whole entire medical team, from doctors to pharmacists to occupational therapists, the physical therapists, were all included in bedside rounds. So they came to the bedside, they talked about the whole plan, what each system, cardiac, GI, respiratory, they talked about all that stuff, what's going to change for the day, if medications are going to change, if the patient is progressing, if they're worsening. Anything like that is going to be talked about in bedside rounds so we can continue to care for this child. And parents are a part of that. We want parents to be a part of that. And in the ER, parents are at the bedside. When procedures are happening, when we're placing an IV, we don't ask the parents to leave. If they want to leave because they don't like watching an IV being placed or they don't like seeing blood or something like that, then they have that option to leave. But we encourage parents to stay by the bedside, to be at the head of the bed so the kid can see them, because it's their comfort. Kids want their parents there. That's what keeps them comfortable, especially in an unfamiliar environment. So family-centered care is definitely a part of pediatrics, and it is like the best and the worst, because you understand sometimes dealing with families can be very, very difficult, and you kind of learn about that as you go. And I can make a different video about how I deal with parents, because it can be difficult, especially when you're caring for their kid and their kid is sick, or their kid is there for a broken foot or whatever, and maybe the parents aren't happy with your care. Maybe they feel like you're not doing all you can, but you are, and they don't understand the other side of what's happening behind that patient's door. Definitely something that you learn as you go about how to deal with difficult families, how to deal with emotional families and things like that. But families are always involved, especially in pediatrics. So if you're gonna be in pediatrics, you have to be able to deal with families as well. Okay. Another thing that is definitely what is in the pediatric world that I absolutely love, guys, I love this, is that we have child life. Child life is amazing. Like, I don't think you guys understand. If you don't work in pediatrics, child life is like, oh, they're lifesavers. They really are. Like, child life specialists, they are there for a reason, and they are literally my saving grace sometimes, because they just are. Like, I can't even, let's just get into it. Child life specialists are there. They do like a lot of variations, but just to kind of keep it nice and simple, just to kind of give a brief description, they're there for the coping needs and to be able to familiarize kids to the hospital environment and to be able to explain procedures and interventions at a level that that particular kid in their developmental age can understand. They have a lot of play interventions, a lot of distraction interventions. If we need distraction for getting an IV in, they have iPads and things like that. They have a lot of sensory stuff for like autistic kids so that we're able to get vital signs or get an x-ray done. They have prizes. Guys, who doesn't like prizes? When we need a kid to get something done, I will be the first to tell you, I will say, we'll get you a prize, because that is how I get stuff done sometimes. So they'll get stuff done, they'll get an IV place, and I will bring in a huge baby doll, a huge Barbie doll, a set of cars, a puzzle, a coloring book. Like, there's a wide variety of things that I can offer them because of child life. And half the time I just text them like, hey, I have a kid in room 21 getting an IV, super anxious. Can you come visit my friend? Like, and they'll come to the bedside and they will work their magic. And then this kid will be so brave and get everything done, and they'll get something at the end. So it's just like amazing. I love them. They do like a lot of bereavement stuff too, but like sad. But yeah, they do like handprints and stuff like that. But they're amazing, and I feel like it helps kids a lot. Like, the amount of things that they are able to offer these kids, especially in an environment where it's so unfamiliar and so scary, is like amazing. They have teddy bears and Barbie dolls that have IVs in them. So I feel like when a kid sees something that they're familiar with, like something so fluffy or a Barbie doll or a baby doll that has an IV, it's so much less scary because now they're twins, and this baby doll and them both have IVs in their hands. So it definitely helps, and they are amazing. But that is something that I feel like I'm very appreciative of in the pediatric world, and it's all that the adult world doesn't have that. I feel like adults need that too, but it's amazing and they're amazing. So yeah, child life is definitely something that you will get to know if you are working in a pediatric hospital. Should have put this, like, talked about this first, or second, but it's vital signs. And that's gonna go into age as well. Like, vital signs are gonna be completely different and the normal values from a newborn to an adult or an 18-year-old. Adults need the same vital signs. When you're 18 and when you're 60, you know the normal range of where your vitals should be. But when you're a newborn and when you are 10 or 11, your vital signs are gonna be completely different for what's normal for that age. So you having a heart rate of 120, 130 when you're a newborn, that's normal. But having 130 heart rate when you're 12, 13, 18 years old is not normal. So that's a red flag. Do they have a fever? Are they screaming and crying? Is it 130 when they're resting with no fever? So what else? Are they dehydrated? And that's why. So you start thinking about what's making it abnormal. But if you see that 130 heart rate in a newborn, that's not a flag. That is completely normal. So it's definitely something that you learn as you go, what's normal and what's not normal in terms of different ages. But you kind of get familiar with it. You kind of know, like, when a kid's coming in, like what's normal resting, when they're awake, things like that. But it's going to be completely different, from heart rate to respirations to blood pressure. An 80/50 blood pressure in a 1-2-year-old, normal. Are you going to want to see an 85 systolic blood pressure in an 18-year-old? No, we're not. We're going to start saying, why is their blood pressure low? So it's definitely very different, and something that, you know, you can have little cheat sheets. I have one that's on my badge. So sometimes you forget, like, what's the normal range? I mean, you get used to it, but sometimes you're having a day and you're like, is that normal? And you can just like reference it. So it's definitely a lot different than being in an adult world when a normal heart rate is 70, 60 to 100. And if you're 120 from 18 years old to 100 years old, 120 is high. So definitely something you'll get used to. So I would say pediatrics, everything is kid size and pediatric size. And I know that kind of sounds self-explanatory, but it really is such a difference. You're gonna have baby cuffs, baby blood pressure cuffs that are so tiny, it fits my finger. It fits around my finger, that's how tiny it is. And then you're gonna have a pediatric cuff that fits a 6-year-old, and then you're gonna have a cuff that fits an 18-year-old, and they're gonna be all different sizes and colors, and you kind of have to see what size you're gonna use for different age groups and what blood pressures. You're gonna use IVs. Are you gonna put an 18 gauge IV in a 6-month-old? No, we're not. We might do a 24 gauge. We might do a 22 gauge in the AC. It kind of depends, and you kind of have to be mindful of different size equipment for different ages. So it definitely varies from 0 years old, 2 days old to 18 years old. So definitely different. that we have to be mindful of as pediatric nurses. Last thing that I feel like is a huge in pediatrics that we learn and it gets drilled into us in nursing school for our pediatric class is medications. Everything is weight-based in pediatrics. We use kilograms in pediatrics. We're not using pounds. So if they come in with pounds, we'll just divide by 2.2 to get to kilograms, or kilograms times 2.2 to get to pounds. But everything's gonna be in kilograms. So you're gonna do 10 milligrams per kilogram for a Tylenol dose. So that way, if you're a 5-year-old and you're an 18-year-old, you're not getting the same exact medication volume. So it's definitely gonna change. You definitely have to keep your medication map up to date and in your head, because it definitely is important to just double check, especially being the last line of checking to do your five rights of medication checks, and to just do your med math and make sure that the dose is correct. So I definitely got that drilled into me in nursing school and in the pediatric ICU, and I still do it to this day as an ER nurse, just to make sure that everything's correct, but everything is gonna be based on weight. For the most part, I love pediatrics, and I'm not gonna sit here and sell you pediatrics, because if you're not a pediatric nurse or you don't like working with kids, or you think that it's too sad, I get that so much. Like, how do you work with kids? It's so sad. Like, they give me life. Like, they are so resilient, and that is like the one main reason why I love them. Like, they are so resilient, and they're braver than I feel like a lot of adults sometimes in getting things done and things like that, that it like uplifts me sometimes. Like, it makes me happy to be able to care for them. You go ahead and you do an IV, or you do something invasive or anything, and yes, they might kick and they might scream and they might cry and they might look at you like you're the lady that just stuck me with the needle. But you come back in there 15 minutes later and they're playing, they're watching their iPad, they're licking a popsicle, they're laughing, they're talking about how they love your shirt, or can I see your badge, or whatever, and they're like back to themselves. I mean, you do have your kids that are wiped out and they're sick and they're tired or they're fatigued or whatever, but they are so resilient that sometimes, a lot of these times, like, they just want to play. They just want to watch TV. We have all these movies on our TV in each room. We have Moana, we have Frozen, we have Zootopia, we have Cars. We have so many movies that sometimes that's all they want to do. Like, can I just get this so I can watch a movie? Like, yes, you can. So yeah, it definitely is. It's very rewarding for me. Like, it's sad. Yes. Do I cry? Yes, I cry. I cry all the time. I cried a lot more, I feel like, as a newer nurse, especially in the ICU, seeing all the intensive stuff. But do I cry to this day? Yes, I do. Do I see death in kids? Yes, I sadly do. And it's terrible. It sucks. But like, it's just rewarding, because I feel like you also see the kids that get so much better. You see the kids that get to get discharged and go home. You see the kids that are doing so well, or they get treatments for asthma and then they can breathe again and they just are so much happier. You see so many variety of things that it just is really, really rewarding. And I feel like parents a lot of times are very thankful. And I love being a nurse, and I love being a pediatric nurse. I love playing with the kids. I love handing out prizes, or even Christmas is like my favorite time, because we get so many donations that handing out just a gift to a kid, like, you don't know their background, you don't know their social history, you don't know if they're able to celebrate Christmas because they don't have enough money, or they're not able to live at their house or whatever. Like, you don't know any of this stuff. So even just being able to give them like a car or a sticker or whatever, like, that might be the highlight of their year, and you're making that difference. So yes, I love being a pediatric nurse, but I love it. It's a challenge all the time. I feel like I see something different every day, and I feel that's how it is in nursing regardless. So yeah, that's kind of my spill on pediatric nursing. If you like this video, please give it a thumbs up. Leave a comment of your thoughts of what your specialty is. If you like pediatrics, if you have questions about pediatrics, I would love to answer them. So leave a comment below. Subscribe to my channel if you have not. And I will see you guys in my next video. Bye.